And then I'll. Okay, hi, Karen. Thank you so much for joining us, and thank you for the chapter to Sick of the System. If I recall, the title is "If It's a War Against COVID-19, Who Are the Soldiers on the Front Line?" So a great title. And I'm wondering, the first question is just quite simply, why did you write this chapter? What was the drive or the impetus behind this chapter?
Probably that I kept listening to our premier, Francois Legault, who is from the CAC, which is a right-wing political party, and he at that time was having press conferences every afternoon, which people called the afternoon mass. And during the mass, he would always thank everybody that was in the healthcare system. And at first he would only thank the doctors and nurses, and then somebody spoke to him and he included the personal support workers after that.
Oh, I see.
But he never ever included the cleaners. I mean, it was, and since I've spent a lot of my career studying cleaners, I was annoyed about that.
Yeah, I was quite struck by that. You begin actually by talking about the cleaners, and that's certainly something that very few authors or commentators about COVID are mentioning.
And yet infections come from contamination, and contamination is when you haven't cleaned up, and cleaning is central, and people do it. It's actual human people that do it.
And so, just out of curiosity, your original draw to studying cleaners, that came about because of?
At the University of Quebec, where I work still as a professor emerita, we have an agreement between the university and the three main trade union confederations, and that agreement, which exists now for over 40 years, it exists for 44 years, provides that the unions can ask for research or training resources from the university, and the university will provide them. So that there is, they will provide course relief for us to give courses in the unions. They will provide at no charge to the unions.
Yes.
Research resources, and they will give even seed money for research projects. So since 1978, I've been working in this context to do research in occupational health and safety, and it actually changed me from, I started my career as a fungal geneticist, and turned into an occupational health and safety person.
That's quite
because of the request from the unions.
Oh, so in a way, you really were, your research was born of the union in some respects. Yeah.
In most respects, it was born from workers' questions, not necessarily. Sometimes channeled through the official channels of the unions, and sometimes when you are in training sessions, you hear an awful lot of interesting things, because one of my colleagues taught me to, before giving my training, she taught me to ask people to describe what they did. And so we would go around the room and listen to what people did. And often that would take a lot of time, because I would comment and ask questions and explain things. And they would explain things to me. And it was a tremendous learning experience and got me quite involved in occupational health. So I changed fields.
Great. Thank you. And the second question, Karen, is if I were to read this chapter, what was the main thing that you wanted me to take away from this chapter? Was there a particular conclusion or argument that you wanted the reader to get? And what would that be?
I think it's the question of the empathy gap. That is, I introduced this concept in my book, Pain and Prejudice, and it's been critical to my thinking, which is that as a person who was raised in the middle class, at first when I was observing people working, I thought they were kind of dumb and didn't understand how to work, and I was going to explain to them how to do their jobs. And it took me a lot of training and a number of years to realize that it's really the other way around. And that if you really want to understand why people are doing their jobs in the way that they are, you have to watch them a long time and you have to ask them questions rather than assuming you know what they're doing. And when you don't do that, you experience this empathy gap, which is that you look at somebody working in and you don't feel for them, you don't understand what they're going through, you don't understand their difficulties. So in the case of cleaners, you walk into a hospital and you see that the floor is dirty and you think the cleaners are responsible for it and they're not working hard enough and somebody should get after them. And if you talk to the cleaners or listen to them or watch them for a couple of minutes, you would, or maybe more than a couple of minutes, you would realize that the cleaner can only clean a surface once and people can walk on it lots of times, number one. And number two, they've been cutting personnel, cleaning personnel and outsourcing cleaning in hospitals for a long time, and there's a cost to that. And number three, the poor cleaners are, what they are doing to cope with the loss of time and the loss of resources and the fact that nobody ever considers cleaners when they're organizing what's done in hospitals. If you want to, if they want to do their jobs, one thing that they can do is increase the concentration of the detergents and cleaning fluids that they use. And that's very bad for their health because they breathe in bad fumes and stuff. So the empathy gap then is thinking that you understand what somebody's doing and criticizing them for it without understanding why it is and what they have to cope with.
Yeah.
So that take-home message is try and understand what's going on and be a little bit more understanding of all the terrible dangers and constraints that the people who are saving us from this pandemic are going through.
Yeah. I was also struck by another way in which there's this kind of work that's unacknowledged is, I think in your chapter you mentioned the work of just being bilingual, you know, in Quebec, to be bilingue. And so, you know, I think that is often not, it's certainly not appreciated out here. I'm in Vancouver on the West Coast, but certainly I think in terms of work, people don't perceive that as work, right? The ability to be able to shift from two official languages is quite a, you know, quite a task, and also quite a mental effort and skill, in fact. And so I think there's an illustration of how people who are cashiers or people who are in service sector are bilingual, but then that skill is not acknowledged whatsoever, or even the effort or the difficulty of doing it. And as you said, I think, and sometimes interacting with people who speak neither language, right? Yeah. So.
Yeah. And also in Quebec, it's a political question. I mean, there was a whole episode about a year ago when everybody was criticizing the store personnel, salespeople in retail stores for saying bonjour, hi.
Oh.
And so that becomes, every time you meet a client, a customer, you have to make this political decision. Am I going to say bonjour? Am I going to say hi? Am I going to say bonjour, hi? Am I going to say hi, bonjour? What is it that, and mind you, so does the customer. You have to make that decision, but it's a whole layer of political bargaining that people don't go through necessarily in other parts of the country.
No, yeah. And perhaps maybe for another day, but it would be lovely to hear your thoughts on of being an Anglophone in a Francophone province. And I wonder if that has had any impact or influence on your research or in your interaction with people that you talk to, or?
Well, generally, Quebec is a much more progressive place, as, for example, signified by our agreement with the trade unions, and we have another similar agreement with the women consortium of women's groups in Quebec, and some also with environmental groups, so that the community has a lot closer relationship with the universities than would be true elsewhere. And my secret is I was born in the United States, so that was a pretty long time ago, and I've been in Quebec for 55 years. But it's been a choice for me to live here because of the political situation and because of the fact that we can do things here that are not as easy to do in other places.
So lastly, you quickly wrote this chapter, so thank you for being such a swift writer. And you would have submitted it in May. So a lot has changed in the last few months. Is there anything that you would change or update or add, or would you write something completely different today? What's your thoughts on that?
Well, I reread the chapter this morning in preparation for our discussion, and I don't think there's anything that I don't agree with. And I remember thinking this morning that they're even more nasty to the elementary school teachers in the newspapers now than they were in May, because everybody's very anxious about the children.
Yes.
And with good reason. I mean, there are so many children who are being affected by the shilly-shallying that our education minister has been doing over, are we sending the kids back to school? Are we not sending the kids back to school? Under what conditions are we sending the kids back to school? Are some of the kids going back to school? Yes. And they have this political position, which I think it's amazing to me, and I don't understand how they can think they're being logical about it, which is that because not all children have internet access, it would be unfair to give support to the children in some organized way during the pandemic, because some children might not be able to profit from it. So therefore, all the teachers are on their own, but they're supposed to be educating their kids as if the pandemic weren't going on, but they don't have any resources to do it because those resources would probably involve distance learning, and not everybody has a computer. But we should really find some computers somewhere to give them, and we do have a few lying around, and let's see if we can find some.
Yeah, yes. Yeah.
And it's funny, but it's scary. I mean, they're so dumb, I guess.
Well, it's an informal, cobbled together, janky solution, right?
Yeah. I mean, I might not do any better if it was me, but I just, and the same thing, of course, is with the hospitals. I guess the other thing that I would add is we did write an op-ed piece that got into 2 of the newspapers about the fact that the problems they're having here is primarily from a tremendous shortage of personal support workers, which you also have in BC, but not as badly. But we have a really terrible problem.
Yes.
And one of the reasons for it here, and I can't speak to any other province, is that about 20 years ago, they decided to treat personnel in hospitals as interchangeable units. So that instead of, if I'm a personal support worker and there's a patient on a ward and I see them on Monday, I have a 10% chance of seeing that same person on Tuesday. Because I'm switched around according to whatever the computer says they need. And so I can be in the same hospital, I can be in a different hospital, I can be on the same ward, I can be on a different ward, I can be on the same shift, I can be on a different shift. And the worst thing about it is that management hasn't yet learned about teamwork, so they don't think it's important. Whereas in personal support work, for minimally, you need another person just to help you lift people. Yes. Or move people, but also you have all kinds of situations where you need help. And I've observed personal support workers, for example, working with a patient who starts to resist, and watching another personal support worker come thundering into the room to help, alerted by noises that I wouldn't even have recognized. And so there's a lot of teamwork, and when you treat people in this way of as units, then a lot of the meaning goes out of their work. And also, of course, they're at much more risk of infection and much more risk of infecting other people. But it's also that you can't really do your job. And so this tendency, which I thought they would wake up to the fact that it wasn't a good idea, they seem to be persisting with it. And it's a very circular, like it's a vicious cycle where you have fewer people, the job gets worse, so you have fewer people. And that has definitely worsened since I wrote the chapter.
Well, I guess we have to really keep our eye on it, because who knows if it's will get better or worse or remain the same, I guess, in the coming months. Yeah.
And the coming pandemics.
In the coming, and yes, absolutely. So maybe I'll be speaking to you again in the future.
Right.
Okay, Karen, that's really great. That's really helps me.
It's been a pleasure.
Yeah, it's been a pleasure, and it helps clarify my ideas about the chapter. Thank you so much for doing this. And
Bye-bye.